Hi, welcome to Healthcare Hoax videos. Today we're talking about a hot topic. What's the hot topic? Oh, you go to the doctor, you say, Doc, I've been having chest pain, I'm really fatigued, there's something wrong. And so the doc puts you through a series of different tests and he says, you have a coronary artery blockage and I have the solution for you. We're going to talk about stents, and you need to listen to me. The stent is going to save your life. Dr. Slavin, might you have a different perspective?
A little bit. I can recall, I think back in my training, I don't even think they were doing bypass surgery yet.
Wow.
They were just beginning.
Okay.
It wasn't very common, and they definitely weren't putting in stents. And I remember when they started to introduce stents, they said it's going to do away with the need for bypass surgery. That was the way they sold stents. Yeah, let's just put a stent in and you won't have to have bypass surgery anymore. So they went from 0 stents to 1 million stents a year, and at the same time, the number of bypass operations continued to go up. I remember asking a cardiologist, a thoracic surgeon, I said, aren't you worried that stents are going to put you out of business? His answer was, we get them sooner or later. So
Wow.
stents are not the solution to the problem. But I'll add, neither is bypass surgery, only in certain circumstances. The American Medical Association has said that as many as 50% of bypass operations are unnecessary. And I'm going to read something to you because it's important. New information that's come out. In a recent study published in The Lancet, these are researchers from the Imperial College in London, and they investigated the difference between patients who received a stent for stable angina and those who underwent a placebo intervention. In other words, they went through the same procedure. One group got the stent and the other group didn't. And they didn't tell the patient or the doctor when they did the study who got the stent and who didn't. And in this particular study, there were 200 participants with severe single vessel blockage from 5 sites across the United Kingdom. During the initial 6 weeks, all patients underwent an exercise test followed by intensive medical treatment. At that point, they were randomly assigned to 2 groups. The first underwent what's called a percutaneous intervention, during which coronary angioplasty was performed and a stent was placed. So that means, they put a catheter into a blood vessel, and that's how they put the stent in. But the other group also underwent the percutaneous intervention. In other words, they put the catheter in the vein, or the artery that they would use, and they did the angiogram, they injected dye, and that's the extent of it. They didn't do a balloon angioplasty or place a stent. So those are your 2 groups. So one basically got a stent, the other didn't get a stent. For the following 6 weeks, neither the patient nor the physician knew if the patient received the stent. At the conclusion of the 6 weeks, patients again underwent an exercise test and were questioned about their symptoms. The researchers found both groups experienced nearly identical improvements in exercise tolerance and no difference in reported improvements of their symptoms. Surprisingly, even though the stents improved blood supply, they didn't provide more relief of symptoms compared to drug treatments, at least in this patient group. It seems that the link between opening a narrowing coronary artery and improving symptoms is not as simple as everyone hoped. And the results were presented at a Transcatheter Cardiovascular Therapeutics Symposium in Denver. Not surprisingly, the Society for Cardiovascular Angiography and Interventions questioned the conclusions, believing that the surgical percutaneous treatments and the placement of stents would be a preferred treatment.
What was very interesting, Dr. Slavin, is they both had an exercise regimen and that they were followed very closely by their physicians. So it appears that the exercise regimen played an enormous role. in how these patients progressed.
But the next statement is going to help you understand why this practice continues to this day. Previous analysis of the benefits of stent procedures supports findings from the featured study. Patients in the U.S. spend $60 billion
Billion.
a year on invasive cardiovascular procedures, although only 5% of the world's population lives on U.S. soil. Now, the other day I looked up longevity tables, and the United States, ranks between 40 and 50th in the world.
Wow, not such a
Yet-
good number.
Yet we're doing all these invasive procedures. Americans undergo half of the world's bypass surgeries and stent placements. Of these stent placements, up to 50% may be done unnecessarily based on current medical guidelines.
How do patients know when they should listen to their physician that they need this procedure? They're frightened. They're told, you must do this or you could die. That's scary.
In another study where they looked at 140,000 patients across more than 1,000 hospitals, researchers found nearly half of the stent procedures were unnecessary. A senior cardiologist in Apollo Health City, and this is in India, commented on the overuse of stents. If you use a stent when the blockage is not significant or if it is in a non-critical artery, that is misuse and unethical, but there is no monitoring in India. The onus of monitoring ought to be on the institutions or hospitals where the procedures are done. And it has to be up to the patient too to self-educate, ask the right questions. But you know what? You're not given a chance. Oh, you have chest pain, they put you into the hospital, you sign the consents, they do the cardiac cath, and while they're in there, they go right ahead and put the stent in. In other words, they don't do the cardiac cath and say, okay, we'll bring you back another day to do the stent after we discuss it with you. It's like an automatic.
Dr. Slavin, what are the stents? What's the material of the stent? What is it made of?
I think the stents are made of different materials, and some of them even have medication put on them to try and prevent the restenosis or clogging of the artery after placement.
How successful is that medication to prevent restenosis?
I don't think it's that successful.
Some of the statistics that I've seen seem to show that within a year's time, there begins to be a restenosis situation.
Correct. That's why the thoracic
rush.
surgeon, I said, says, I'm not worried about stents, we get them sooner or later.
Wow.
The stents fail, and then they have to go for bypass. You can't take out a stent once it's put in either. I've had patients with 5 or 6 stents in place. It wouldn't be the approach I would recommend. I think the best recommendation with regard to stents would be you're having an acute MI, heart attack, and you want to open up that blood vessel to allow blood flow to the heart. In that situation, a balloon angioplasty and stent makes sense. But when someone has, as we mentioned earlier, stable angina, yeah, they have some angina, and you do the balloon angioplasty for that. There may not be much benefit to that approach over medication to treat that problem. Janet, in one study, researchers found 7.6% of those undergoing angioplasty experienced at least one serious side effect during hospitalization. And that's another point. None of these procedures are without risk. There's always a risk, especially when you're dealing with the heart.
One of the things that I'm thinking of is, okay, the medication placed in that stent, that patient may very well have a reaction or some kind of side effect to that implanted medication. And as you said, once the stent is in place, it can't be removed.
Now, one of the largest hospital chains in the U.S. came under scrutiny in 2012 when allegations were made that thousands of unnecessary heart procedures were performed.
So Hospital Corporation of America, I talk to people all the time about when they go to a hospital and it's a for-profit hospital chain, they need to go with an advocate. They need to ask for time to step back and consider the consequences of what is being offered to them, as well as the potential for seeking out a second opinion.
Not only is it important, a lot of times you don't have the time to seek out a second opinion. That's the problem. That's why it's so important to identify these problems before they become emergencies. When it comes to the heart, there's a test you can do called a calcium score. That'll give you an indication of the amount of plaque buildup, so you have an idea of what's going on. You can do a perfusion study to see if the heart is getting enough blood flow. So there are, studies you can do, but you don't have time to do them in an emergency. So that's why it's important to, find a physician that'll recommend these tests if he feels that you're at risk. Now, more than 1.5 million angioplasties and bypass surgeries are done each year in the U.S., making them the most commonly performed procedures. Now, here's the point. Although Americans are 7 times more likely to undergo these surgeries than patients in Canada or Sweden, the death rate per capita is nearly identical in all 3 countries.
Wow.
So it's not making a difference, but we're spending, what do we say, $30 billion a year on these procedures. The American Heart Association recommends angioplasty and potential stent placement if you are experiencing consistent chest pain or discomfort, or if the blockage puts you at immediate risk of a heart attack or death.
Dr. Slavin, I know that over the years you have used with your patients, both the patients who are very much interested in preventive approaches, as well as those people who've been diagnosed literally with a serious compromising heart issue. What are some of the things that you do in your practice so that people are not so vulnerable to being rushed into an emergency situation?
Well, we do chelation therapy, and the patients getting chelation fall into actually one of 2 groups. One group is getting it for prevention, and the other group is getting it after the fact. A patient comes to mind, he's already had bypass surgery, his chest pain came back, but he's not going back for bypass surgery. He's getting chelation therapy. The history of chelation therapy goes back to the 1940s, when it was discovered that in the treatment of lead toxicity, these happen to be military personnel who were exposed to lead, painting ships and things like that, became toxic, and the treatment is chelation therapy to remove the lead. They observed that those with angina, those symptoms cleared up. And that was repeated over and over again, getting the same results. So it was discovered that removing heavy metals from an individual helps reverse these conditions. Another study was done in Europe with chelation therapy, where this was a town on a highway and they chelated half the town, and the other half wasn't chelated. And in this particular study, they were looking at the incidence of cancer, and that incidence went down 90%.
That's so interesting, and the part about chelation therapy that I think, okay, you're 45, 50 years old. You have not necessarily been completely focused on a health supporting diet. Your travels, your profession might have exposed you to some toxic debris. The water you drink could possibly be treated with fluoride. The foods you eat might have been exposed to aluminum. You might have been exposed to some sorts of inhale toxins. And so at that particular age, I think it's a very reasonable thing to do a certain number of chelation therapy treatments in order to get rid of that toxic debris. And that story about the town half chelated, half not, and the issue with cancer says that the benefits of chelation therapy go far, far, far beyond when people are concerned about heart and circulatory health. So preventive chelation therapy, Dr. Slavin?
Oh, absolutely, makes perfect sense. Well, how do you know if you should start chelation therapy? Just do a test for heavy metals. Heavy metals being lead, mercury, arsenic, cadmium. If you're accumulating more than expected, then you want to remove them from your body. Now, you have to do the test the right way, and a blood test is not the right way because these toxins are not maintained in the bloodstream. They're immediately pushed off into your tissues. So you have to do a provocative test using either a DMSA or a EDTA, and you collect the urine and you see what's being pulled out of your body. And none of the, there's no safe level of lead, arsenic, cadmium, or mercury in your body. So if you're finding it, it should be removed.
So what about a hair analysis where people test a certain strand of hair from the back of their scalp?
Hair analysis is an option. I reserve it for kids.
Okay.
Because why do a second best test when you have the provocative challenge test available?
Okay, Dr. Slavin, I was just reading a very interesting article. It was so frightening, and it was about the potential for a flu that seems to be developing somewhere in the Far East. I'm not sure whether they said Thailand or Korea. I don't remember the country, but they were talking about a particular strain of a virus that had the potential to create a global pandemic. And do you have any thoughts about how concerned we should be about the potential for a pandemic?
Well, I think you mentioned the last pandemic was 1918.
Right.
Think about how things are different from a sanitation point of view,
True.
from a nutrition point of view. Those two factors play a major role in how infections are transmitted. Also, the body's ability to resist infections. So I'm not sure you can just take into account the emergence of one new strain of flu and say automatically that you're going to get the same results that we had back in 1918. The other thing that has to be kept in mind, and this was a recent article about how they make the flu vaccine.
People need to know.
They picked the strain out, and then they cultivated, usually within an egg.
Right.
And they say that flu vaccine that they're making, that flu virus that they're making a vaccine for is mutating within that egg.
Whoa.
So you don't come out with the same vaccine that you started out with, which is another real problem. And that may be why you never hear what the number of flu cases are after the season and how effective the flu vaccines were. Do you ever hear that? I never hear that statistic. Just how effective was the flu vaccine. You hear people who had the vaccine getting the flu.
Oh, I hear about the people who've had the vaccine, and they come to me, and the color in the pallor in their faces, the lack of vitality, and they talk about how they haven't felt well since getting the vaccine. And when you start to think about all of the different things that are part of the vaccine culture and creating the vaccine, it's pretty scary stuff.
Plus, it's been reported that after getting the flu vaccine, it weakens your immune system for subsequent years. So that there may not be a overall plus to getting vaccines.
I have a pretty I'm gonna say controversial statement. I once, years ago, came across a list of 5 categories of things that people do that can be contributing factors to the development of Alzheimer's disease. And one of them is 5 consecutive years of flu vaccines. And so I think about all of the people in healthcare, working in hospitals and clinics and so on, that are required by their employers in order to maintain their jobs. They have to have that annual flu shot.
Well, it was reported that the appearance of the brain in Alzheimer's patients was a result of repeated infections.
Ooh,
And maybe the vaccines are another contributing factor.
artificially induced infection. Oh my goodness.
Yeah. So,
Huh. We've got to do a healthcare hoax video on vaccines. I think certainly there are so many people who are rushed into making a decision, and then they pass all of the drugstores on the corners and they have the signs up, get your flu vaccine here.
plus recently there was a measles outbreak and they found out that 80% of the people that came down with the measles have been vaccinated. So that begs another question, how long does the immunity last when you have a vaccine? We know that when you are exposed to these viruses naturally, you usually gain lifetime immunity.
Ah,
But it's not
okay.
the same when you give yourself a vaccine.
So sometime we'll write up an outline and do vaccines. I want to do
Alright.
that, okay? So once more, here on Healthcare Hoax Videos, you're getting some information so that you are not vulnerable to the hoaxes that might be out there in our healthcare system. I'm Janet Cimorelli. You've been listening to Dr. Herb Slavin. And remember, when you go to healthcarehoaxvideos.com and subscribe, you'll get a notification when our next video is posted. So we'll see you soon with the next topic here on Healthcare Hoax Videos.